Great. Thanks, Bridget, and thank you for joining us today. I'm Patty Enrado from HIMSS, and I'm joined by Cliff Dinwiddie from Spectrum Enterprise. HIMSS conducted recent research on the current state of innovation in healthcare, and one of the top findings is that U.S. hospitals and health systems most widely prioritize initiatives to drive operational, process, and financial efficiencies and to enhance the patient experience. But realizing those initiatives demands a strategy that incorporates the right people, processes, technology, and partners. So in this webinar, we'll share key findings from a three-part research series on the anatomy of innovation sponsored by Spectrum Enterprise. We'll focus on new research that sheds light on the role of the IT decision maker in healthcare today. And we'll discuss how hospitals and health systems can best align their IT agenda and workflow priorities to advance digital health innovation.
Hi team, my name is Cliff Dinwiddie. I will be your co-presenter here today with Patty. I am from Spectrum Enterprise, and at Spectrum I've got responsibility for vertical marketing and programs. And as Patty indicated, we performed this research with our partners at HIMSS. And in fact, my team leads research like this quite frequently. But the reason that we're having this webinar with you today is because we thought that the responses that we got back here were incredibly insightful. More important, these responses, I think, are promising from two angles. Number one, we think that the findings in this research really helps to inform the way that hospitals and health systems think about and approach innovation. And number two, we think the findings in this research really help to inform the way that those of us who support hospitals and health systems, it informs the way that we support and approach them. So that's why we wanted to share these findings with you today. There is just really fascinating, insightful stuff in here. So Patty, let's move to the next slide and dig into this.
Great. So we partner with Spectrum Enterprise for a three-part survey from August to October 2019 called the Anatomy of Innovation. So from these surveys, we wanted to find out if hospitals and health systems are hindered in their efforts to innovate. And if they're hindered, we wanted to identify those barriers. So we hypothesized that infrastructure is a critical foundational piece that healthcare organizations need in order to innovate, and a critical foundational piece that's best put in the hands of their information and communications technology vendor to power. And finally, we wanted to introduce the concept of innovation readiness, or innovation as a service, meaning that a forward-thinking platform can help healthcare organizations ensure that their foundational infrastructure is ready for the future. So from the research, as I pointed out in my introduction, survey respondents cited enhancing the patient experience, driving efficiencies, and improving the clinician experience as the top three priorities for their healthcare organizations' digital health innovation goals. But where do healthcare organizations even begin to achieve these goals?
You know, Patty, as I stare at page 3 here, I guess one thing really pops out at me. Everyone, stare at the first two horizontal bars. Remember, we surveyed more than 600 respondents across hospitals and health systems, and the question that we ask them here is, how important are each of the following to your organization's digital health innovation? Look at the top two answers. I find this fascinating. Answer number 1, enhancing the patient experience, evolving PX. No surprise. I think all of you on the call, that won't be a surprise. But look at number 2. The second priority as it relates to forwarding digital health innovation, it's about driving operational, financial, and process efficiency. Said differently, pulling cost out of the business. I want you to think about those two top priorities side by side. What I think is fascinating about these two is that at first glance, they might even appear to be sort of mutually exclusive, one fighting against the other. How do hospitals and health systems improve and invest in PX while simultaneously pulling cost out of the business? That tension, the tension between those two things is at the very center of the findings that we're going to cover with you today. So Patty, I'm super excited. Let's move to page 4.
Great, absolutely, Cliff. So IT is a key driver for digital health innovation, but finding time to innovate and disrupt is a huge challenge, especially when compared with day-to-day priorities. So resource and workforce issues, they continue to be barriers. So let's take a look at the digital health innovation trends we're seeing in the U.S. healthcare system. So the Anatomy of Innovation research highlights the importance of digital transformation. So approximately 8 out of 10 survey respondents reported that they're pursuing one or more digital health innovations. So the push for digital health innovation, so this investment in innovation and technology in healthcare, is spurred by myriad global challenges. So the silver tsunami and aging populations, the rise of chronic disease and comorbidities, the shift from fee-for-service to value-based care, and healthcare consumerism, and that's just to name a few. But the results of digital health innovation are fragmented. So as this figure shows, only 3 out of 10 are making progress on an enterprise-wide basis. And as you can see, the rest are either still rolling out initiatives on a specific use case basis, or they're still in the early stages of pilot testing or planning. And what that tells us is that hospitals and health systems aren't on a level playing field, so from their financial resources to their technology implementations. So Cliff, what are your thoughts on this uneven digital transformation in healthcare today?
Yeah, you know, Patty, it's interesting. As I stare at the chart here on page 5, what pops out at me is one bullet, and that bullet is that everyone is trying to innovate. And in fact, if I squint my eyes and look at this horizontal bar, 79% of the 600 respondents across hospitals and health systems, 79% of all of you in this audience have responded and said that innovation is important. It is a priority. And you can see the subtending portions of this horizontal bar just basically tell us that hospitals and health systems are in various stages of the effectuation of this attempt at innovation. So team, the takeaway from page 5 is everyone is trying to innovate. In fact, to be very specific, 79% of respondents are trying to innovate. That, for me, Patty, is the big takeaway on page 5. Let's get underneath these numbers. What do we have on page 6?
Right. So our research clearly shows that most healthcare IT decision makers and influencers are struggling to find time to innovate or disrupt. More than 9 out of 10 survey respondents report that they can't innovate or disrupt, and that's a result of limited resources, competing demands and priorities, and unaligned culture or policies, among other things. So, Cliff, what do you find striking about these data points?
Well, a couple of things. First of all, I love the smiley face, frowny face chart. It just makes me happy. But here's the takeaway here on page 6, Patty. Remember the story from the previous page was everyone is trying to innovate, and I believe the number was 79% of respondents are trying to innovate. Here on page 6, and as we transition to page 7, here's the big takeaway. 95% of respondents are struggling to innovate. So everyone is trying and everyone is struggling. Let's move to page 7, and team, when you see the chart on page 7 and you see the verbatims that are going to pop up here in just a second, you're not going to see anything that is a surprise at all. The reasons that 95% of respondents are telling us that it's tough to innovate is for one reason, and I call that reason the tyranny of the urgent. Innovation requires a dedication of resources. It requires focus. It requires a fair amount of analysis. And the same people at hospitals and health systems that are fighting the daily fires are the same people who are tasked with driving this innovation. And when you have a fire in your face today, and you've also got a requirement to innovate, the fire will win every time. I won't belabor the verbatims that you see here on page 7 because all of you on this call are living these verbatims. This is what you struggle with every single day. So let's remember where we've come from. Everyone is trying to innovate, 79% of respondents, and 95% of those respondents say that they are struggling to drive innovation. Why? Because of the tyranny of the urgent, because of limited staff, because of distributed budgets, because of distributed decision making, all of the reasons that all of you are very familiar with. That's why they are struggling. So Patty, that's the takeaway that I see between page 6 and page 7.
Great. So we're going to take a deeper dive into the data around the view of IT as an innovation driver. So our research further uncovered that survey respondents' own role in the innovation process influenced their perception of the IT function within the organization. So as you can see in this chart, those leading or championing digital health innovation are 3 times as likely to view the IT organization as a key driver of innovation. So one IT director from our survey offered this commentary: for innovation to happen, an organization must have, quote unquote, leadership with an innovation mindset.
Yeah, you know what, Patty? I think whoever gave us that verbatim is 100% right. And, you know, as I stare at the chart here on page 8, the takeaway for me is this. The hospitals and health systems that are winning at innovation are winning because they have IT at the table as a strategic partner. They have IT at the table as a real driver of innovation. They have IT at the table as an innovation partner. They aren't thinking of IT as strictly a service provider or a cost center. Remember where we've all been. IT used to sort of serve that role. IT was a service provider to the rest of the enterprise. IT was a cost center. But the takeaway here on page 8, according to the 600 respondents to this survey, is that the people who are being successful in innovation, they are successful in part because IT is at the table with them, driving innovation and partnering to make that innovation happen. I think that innovation mindset that we heard in that verbatim, that's what this is. IT is at the table. That's part of that innovation mindset, Patty. So really important takeaway here. Let's look at page 9.
Right. So we wanted to know, how are these IT decision makers spending their time? And as you can see here, IT decision makers are spending most of their time running tactical or operational activities, that are focused on improving operational performance. And the rest of the time is divided by managing or resolving routine functional needs and cost control and expense management. But we did glean some good news from their daily priorities and routines. So activities that are first steps to innovation made the top 5 list. And that's implementing new technologies, aligning IT with business or clinical goals, and redesigning business and clinical processes. So Cliff, what can these stakeholders do to free up more time to innovate?
Yeah, Patty, as I stare at that's a really good question. As I stare at page 9, the word that pops out to me is outsource, right? So think about the way that our discussion has been going so far, right? We've talked about the tyranny of the urgent. We've talked about how the same resources at a hospital and health system that are tasked with managing the day-to-day operation are also tasked with driving innovation. And we talked about how that day-to-day operation will always win. It is the tyranny of the urgent. If you want to do this better, if I look at the tasks here on page 9, all of these things could benefit from some outsourcing. So the one takeaway from me here is that hospitals and health systems could consider outsourcing some of this work to free up the time, the focus, and the dedicated resource to actually evolve innovation forward. So that's kind of the takeaway that I see here on page 9, Patty. Show me the ICT solutions on page 10, if you would.
Sure. So, and it's great that IT decision makers are engaging in these next step activities, but we need to ask a question that's important in the advancement of innovation. So are healthcare organizations optimizing their information and communications technology or ICT investments to support innovation? So as you can see here, about half say yes, but a closer look reveals that a third say no for 4 out of 5 of these categories. They're spending too little on TV, video, cloud, data connectivity, and managed network services. And we see the growing budgets for ICT, but another important question that we need to ask is, where is that spend going? Is the spend going in the right areas? So not surprisingly, lack of time, funding, and staff, they continue to be barriers for healthcare organizations that want to drive innovation. So in this next section, we're going to look at how IT and healthcare organizations are tackling these challenges, and we'll explore how technology can break down those barriers and open the door to innovation. So in our research, we found that only a quarter make identifying opportunities for innovation a top priority at work, but fewer than 2 out of 10 are routinely leading innovation efforts.
Patty, yeah, that's exactly right. Team, look with me here at page 12. Here is the really unfortunate statistic that sort of jumps out at me. Remember, what we're talking about here is hospitals and health systems' ability to focus on innovation. This question, again, was posed to the more than 600 respondents to this survey. Look at the answers that came back. I want you to look at the donut chart on the far right. Only 16% of respondents are actually leading innovation or digital health efforts. This is a look at how these healthcare IT people are spending time across hospitals and health systems in this country. 600 respondents have come back and said that only 16% of their time at work is focused on leading innovation for digital health initiatives. Now, think about what we've talked about. We know why. It's the tyranny of the urgent. It's IT may or may not be at the table as a strategic partner. That 16%, I think, is really telling. That 16% should really inspire all of us, those at hospitals and health systems, and those of us who have the honor of supporting them. We ought to be thinking about this a little bit differently. So Patty, let's get underneath this and let's figure out how maybe we could work together to evolve this forward and make it a little bit better.
Right. So, well, one key point from our digital infrastructure readiness research is digital infrastructure is almost universally recognized as a key enabler to advancing innovation. So 9 out of 10 at least somewhat agree, and 76% strongly agree or agree with that statement. So this is really important, the recognition that many see their digital infrastructure as an enabler to digital health innovation is a step in the right direction. Stakeholders and decision makers are now looking at infrastructure and innovation in a more strategic way.
Yep, Patty, I agree. So a couple of things pop out at me from this chart. As you correctly point out, 76% of the more than 600 respondents to the survey agree that their digital infrastructure is the key enabler to their innovation. The truth is, Patty, there is one digital infrastructure at a hospital and health system upon which all of that innovation rests. So what I like about this chart is that it sort of codifies the recognition that digital infrastructure is the very foundation upon which innovation is built. But look at the horizontal bars directly underneath it. 76% of people agree that digital infrastructure is a key enabler of innovation, but only 70% say that investments in the information, communication, and technology solutions are made proactively in order to forward that innovation. So we agree digital infrastructure is critical, but we aren't really investing in the ICT solutions that will drive that innovation forward. Look at the bar beneath that. Only 69% of people are taking the necessary steps to evolve that digital infrastructure forward, and gulp, Look at that last row. 64% are actually making progress on this. So this chart says digital infrastructure is critical. It is the ticket to play. It is the foundation upon which innovation rests, but only 64% of respondents are making any progress toward that innovation. That's the big takeaway here, team, on page 13. Patty, let's look at page 14 and get underneath these numbers one step further.
Yeah, well, our research shows that survey respondents view ICT solutions as critical or very important to advancing their healthcare organization's innovation agenda. ICT providers deliver so many key solutions, data connectivity, managed network services, and cloud solutions that allow access and offer agility and flexibility. And so while the importance of the role of TV, video, and voice solutions in digital health innovation is lower on the priority list here, HIMSS has conducted other research that's shown that, in fact, they can be critical areas of opportunity for healthcare organizations to deliver better patient experiences. And to add to that, our research reveals that connectivity is critical to advancing innovation. So we're witnessing it in real time today with the healthcare industry, really dealing with the pandemic and the myriad funding programs that's been, created to support the implementation and expansion, of telehealth.
One of my favorite topics, Patty. Team, as Patty correctly points out, right? Again, the question that was posed to these survey respondents was, how important are these particular ICT solutions to the advancement of your digital health innovation initiatives? Not surprisingly, data connectivity, right, sort of the baseline, that foundation that we were talking about just a moment ago, rises to the very top. 82% of respondents agree that data connectivity is absolutely critical to the advancement of digital health innovation initiatives. And when you think about, data connectivity, an easy way to think about this is telehealth, right? So think about telehealth. You've got a provider, and then you've got a distance, and then you've got a patient. And telehealth is about making that distance between the provider and the patient disappear. That's what telehealth helps to do. Data connectivity is absolutely required for telehealth to work, right? So number one, 82% of respondents say that data connectivity absolutely critical. The only other bar on this chart that I'll clear is bar number 2. 80% of respondents agree that managed network services, including SD-WAN and Wi-Fi and routers and such, are absolutely critical to the advancement of digital health innovation initiatives. And this makes sense too, right? Think about what's happening in hospitals and health systems. Think about remote monitoring of patients. Think about how what we talked about at the very top of our discussion, where hospitals and health systems need to pull cost out of the business. Wi-Fi is a critically important technology to allow hospitals and health systems to do exactly that. How about remotely monitoring patients in rooms to do things like fall prevention, just as an example? So as I look at this chart, Patty, here on page 14, that data connectivity shows up at the top at 82%, say that it's critical, makes absolute perfect sense, followed in close second by managed network services and Wi-Fi, also makes perfect sense for the reasons that we've discussed. We all know, right, that we are trying to improve patient experience according to the 600 respondents to this survey, and we're trying to pull cost out of the business. What I see here on page 14 lines up perfectly with that, Patty. So now I am incredibly excited. Patty, show me what's on page 15.
Right. So until recently, IT departments controlled the overall technology budget. But as technology has become deployed across departments, really across the enterprise, the IT budget has become increasingly distributed. So our research reveals that IT controls, on average, only 39% of technology spend to support digital health initiatives, and a whopping 61% is outside of IT's direct control.
Yep. So team, remember what we talked about early in our discussion. We said that the hospitals and health systems that are winning at innovation, they are doing it because they've got IT at the table as a driver of innovation or a critical innovation partner. But look at what you see here on page 15. IT only controls 39% of that budget in those initiatives. That is a big tension, right? Budget used to be centralized in IT. IT used to be that service provider, that order taker, that cost center, and now this chart says that these budgets have been distributed. In fact, mostly distributed. IT only holds on to 39% of those budgets. That is going to make innovation a challenge. Patty, show me 16, because I think we get underneath this number one step further.
Right, we're going to dig deeper. So despite ICT solutions getting a growing share of the overall budget, for 3 out of 4 healthcare organizations, according to our research, 2 out of 3 feel they're spending too little in one or more of the areas measured to successfully support their digital health initiatives. So in many cases, those technology dollars are shifting to clinical department of programs like radiology, pathology, pharmacy, and also patient experience functions like telehealth.
Yep. So think about what we saw in the previous chart, or I guess 2 charts ago, right? We said that IT only controls 39% of this budget. This chart says that 47% of this is owned in the clinical department. So what we're talking about is there is one platform, there is one digital infrastructure upon which all of this innovation rests. There is one generally organization that manages that digital infrastructure, and that is IT. The challenge is IT only owns about 39% of the budget. 47% of the budget is sitting with these clinical departments. What that creates is a challenge of coordination. What that creates is an opportunity for what we call scattershot innovation efforts or shadow innovation. And everyone within the sound of my voice knows what this is. What happens is budgets and decisions get distributed, and the clinical department, let's pick on them, the functional area is going to build a technology solution that works myopically, usually, for their functional area. That solution may or may not integrate well across the enterprise, but all of those shadow innovation efforts have to ride on the same digital infrastructure. This idea of scattershot innovation that's the result of a distribution of budgets and decision-making creates yet another challenge that hospitals and health systems face as they try to innovate. Now, Patty, as we move to page 18, talk to me about the challenges that they are facing as a result of that scattershot innovation and that shadow innovation that I was talking about.
Sure. So siloed innovation, that you are talking about, Cliff, that's likely occurring as a result of tech dollars shifting to clinical departments or programs. And that's just one challenge that stakeholders are facing when they're trying to establish enterprise-wide innovation through their digital infrastructure. So our research shows that these stakeholders are facing a variety of digital infrastructure challenges. And those challenges include difficulties with integration of systems, data, and devices, concerns about compliance with regulatory requirements, and challenges identifying and remediating cybersecurity risks. And if you look further down the list, you're going to see that at least 1/4 of survey respondents note that managing operations during the integration of new technology and ensuring uptime is in their top 5 challenges.
Patty, that's what this chart makes me think. This is hard. Innovation is a challenge, right? Look at these top 2 horizontal bars here, team. Bar number 1 says that the integration of new solutions with existing software solutions and legacy systems is one of the most significant challenges that hospitals and health systems face as they try to forward their digital health innovation initiatives. That makes perfect sense, doesn't it, team? Particularly in light of that scattershot innovation that we talked about a moment ago, that shadow innovation that happens as a result of that distribution of decisions and budgets, right? That makes integration hard. You can see 43% of respondents agree innovation is hard because innovation is hard because integration is hard, number one. And mix that with that second bar, the second horizontal bar right below that, 41% of people say that supporting regulatory and compliance requirements is a challenge. So think about this. Distributed budgets lead to shadow innovation. That shadow innovation creates real challenges with the integration of those scattershot innovation initiatives. And on top of that, hospitals and health systems have to manage through a very complex and onerous regulatory environment. Patty, that is hard. So show me on page 19, what are they doing about this?
Right. So, Cliff, why don't you walk us through, some of the tyranny of the urgent and, some of these other challenges.
Good catch, Patty. I'm so excited about the presentation, team. Look at page 19 and think about how we started our discussion. And we talked about everybody innovating. We talked about 95% of survey respondents saying that they are struggling to innovate. And I showed you a page that has verbatims on it. This is the numeric representation of those verbatims. And what you'll see here on page 19 won't be a surprise to anyone within the sound of my voice. First and foremost, budgets are a huge and very significant challenge for hospitals and health systems. Number two, evolving healthcare models and delivery initiatives, another thing that makes innovation challenging. Exponential growth in the number of connected medical devices or the Internet of Medical Things. Think about that Wi-Fi discussion we had just a moment ago, right? Monitoring patients for falls in hospital rooms. All of these challenges, the tyranny of the urgent, the day-to-day fires that these people are facing, this is what vexes our ability to move innovation forward across hospitals and health systems. The verbatims that we showed you earlier in this discussion are now represented here numerically. Patty, these people are facing a big challenge. Now let's talk about what we can do to make it better.
Right. So with all of these challenges in the way, how can healthcare, the question is, how can healthcare IT leaders overcome these barriers and truly become innovators for their healthcare organizations? So successful innovation requires all parts of the system to work together. And that means partnering with an information and a communications technology partner like Spectrum Enterprise. So as more and more of the responsibility for protecting, maintaining, and advancing the critical infrastructure foundation, as that's transitioned from the healthcare provider to the ICT vendor, healthcare organizations are going to need to rely on those vendors more than ever to help drive innovation. So in fact, 9 out of 10 from our survey report the desire to rely to some extent on their ICT vendors to act as innovation partners. So partners that actually help to incubate and develop solutions, that are needed to deploy cutting-edge innovation and transformation strategies. ICT vendors can serve as a true strategic partner that can tap into their breadth of experience to help healthcare organizations, and I'm going to borrow a famous line from Wayne Gretzky, to skate to where the puck is going, not to where it's been. So let's talk about what an innovative partnership looks like. First, let's start with a quick reality check. How are most healthcare organizations managing their ICT vendor relationships today? So the majority are still relying on standard service level agreements, SLAs. So in fact, 4 out of 10 are still using basic SLAs tied to outcomes like network availability, while nearly half are moving beyond basic SLAs as a measure of performance to more complex agreements that align performance with business goals. So Cliff, let's talk about the desired state.
Oh yes, Patty. So if you think about the slide that Patty showed us on page 22, page 22 showed us the current reality. The current reality feels a little bit more transactional, current reality doesn't feel as strategic as it needs to be. And pause for a moment and think about all of these challenges that we've spent the last hour articulating, right? Distributed budgets, shadow innovation. IT may or may not be at the table. IT only owns 39% of the budget. Of course, these survey respondents desire a more evolved innovation partnership with their ICT vendors. That's really one of the main reasons that we wanted to share this research with all of you, right? IT has this vital role in innovation, and as we think about how hospitals and health systems are trying to push this forward, and they've got this tyranny of the urgent, they've got these fires that they are managing every day. And we showed a chart earlier in our discussion that showed how these survey respondents are actually spending their day. And from my memory of that chart, I think only 16% of people are spending time actually leading innovation. They need help. They need a partnership with an ICT vendor that is far beyond standard SLAs and KPIs. True ICT vendors that can act as a partner spend a lot of time staring at the vertical, in this case, healthcare, and what is top of mind for them. And they have got dedicated resources to help partner, not just on, sort of myopic technology solutions, but on a much broader, more comprehensive innovation strategy. So the takeaway here on page 3 is that these survey respondents are crying out. They're all saying, oh my gosh, innovation is really hard. It's hard for all of the reasons that we have articulated. These ICT solutions are critical, particularly data connectivity. They're critical for innovation to move forward, and I need a better partnership with my ICT vendor. Patty, that is the story, I think, that pops out from page 22.
Right. So we've covered a fair amount of ground in today's discussion. Some of the things that we, should be asking ourselves based on our research is, 5 important questions. So, is your staff able to dedicate time to innovation? And, as we've talked about, day-to-day grind of getting a lot of operational things done, outsourcing will able to not only free up your time, but when you partner with the right IT vendor, you not only free up your time, but your vendor can help you, innovate as well. So the second question is your organization's approach to innovation strategic rather than fragmented? And again, once you have that ideal partnership, you're going to get a lot more from that partnership than, just taking care of, some of the strategic, some of the tactical things, but also the strategic, things that you need to be able to innovate. The third question is, does your organization have the right technology infrastructure in place to support innovation? So as we saw in our research that survey respondents, definitely said that, the digital infrastructure is important for innovation. So you want to be able to make sure that you do have the right infrastructure and the right partner. 4, has your organization anticipated and addressed the challenges facing your digital innovation program? And again, it goes back to that partnership. If you're able to really have a great ICT partnership, let them use their expertise to help you, with those challenges that you face on an everyday basis. And 5, is your organization getting the maximum value from your technology vendor partnerships? So as we've seen, it's slowly shifting away from SLAs to, really tying in value into those partnerships. So Cliff, any final thoughts before we open this up for questions?
I guess my final thought, Patty, would go like this. Team, first of all, Patty, thank you. Team, thanks for investing this time with us. I think the big takeaway is that this research, these responses from more than 600 representatives of hospitals and health systems across this country, this is really insightful and informative. This should be baked into the way that hospitals and health systems think about the way that they approach innovation. These responses should also be baked into the way that ICT vendors and all of us, frankly, that support hospitals and health systems support them. So I think this research is really important. We know that they're trying to innovate. We know that they are struggling, and we know why. So hospitals and health systems, I think there's a big takeaway for you here, and for all of us that support them, I think really clear and important guidance. So Patty, that's kind of my takeaway from our session today.
Great. Thanks, Cliff, and thank you all for joining us today. So let's open this up for questions from the audience. Bridget?
Sure, absolutely. So I'm going to jump in here, read off some of our audience questions, but I do want to remind the audience that you can continue to send in your questions using the Ask a Question panel on your screen. We have a few in here already. So this first one here is for Cliff. With the pandemic obviously impacting healthcare so heavily, what types of unusual requests are you seeing from your customers?
Oh gosh, it's been quite an adventure, Bridget. I'll tell you. So two things. Number one, hospitals and health systems need more bandwidth now than ever before. That's the big first and foremost request, and that's for reasons that I think are super clear to everyone within the sound of my voice. The other thing is telehealth. Telehealth that has been this sort of burgeoning thing that's kind of been bubbling for years now has really taken off in a big and meaningful way. So the pandemic, I think, has created two things that we see from our hospital and health systems clients. Number one, significantly increased bandwidth demand, and number two, telehealth is now more important than ever before.
All right, thank you so much. Next question here, I'm going to ask to Patty. There was a data point early in the webinar that said digital health progress is being made, but efforts are fragmented. That 79% of respondents said they were engaged in these efforts. That survey was done in the fall. Do you think that the focus on COVID-19 has slowed or stopped those efforts?
Yeah, so, obviously that's really hard to say, short of asking that same question to the same, set of respondents, but I will say that we can imagine both scenarios, right? One in which healthcare organizations, are just so overwhelmed that everything in terms of, technology advancements, supporting digital health initiatives, has either been slowed down or halted. The flip side are the healthcare organizations, that are realizing that, they won't be able to get ahead of the curve, if they stop their efforts now. So that's why it's really important to them, that they partner with the right, ICT vendor, that can take on that load for them, as they shift to dealing with the pandemic. You may have, you may very well have to shift your priorities, focusing everything on taking care of your clinicians, the rise of patients in your ICU, taking care of your non-COVID, 19 patients, and it goes on, but you can, confidently shift those digital health initiatives to your technology partners, and continue with digital health progress, while you're, still dealing with the realities of the pandemic, and once we've reached the other side of this pandemic, your healthcare organization, has not only weathered, a really difficult time, but has continued to innovate and continued to thrive and, continued to keep pushing and achieving goals like enhancing the patient experience, and driving operational efficiencies.
Awesome, that's great. Our next question here for Cliff, on one of the first slides, you talk about patient experience being a major driver for innovation. Everyone says they're trying to improve the patient experience, but what types of things are you seeing healthcare providers do to achieve this?
This is an easy one. The answer is interactivity. Patients, not unlike my enterprise customers, aren't shy in telling us what it is that is important to them. Patients want more self-service opportunity. Patients want more, they want to feel more in control of their care, and patients need more interactivity with their provider. Couple of thoughts, couple real-world applications that I'll offer as examples. Example number one, interactive patient systems, IPS, are critically important for this interactivity. And think about what that does, right? It sort of puts the patient in the driver's seat. The patient gets to understand what's on the menu, understand what medications have been ordered, understand what the aftercare plan looks like, communicate with the staff that is supporting them and caring for them. So interactivity is absolutely top of mind as it relates to driving PX, or patient experience, forward. The other piece of interactivity that I would point back to is telehealth, right? Telehealth is another opportunity for patients to be interactive and more in the driver's seat of their care. So the short answer to this question is interactivity. It is all about interactivity. Interactivity equals patient experience.
All right, very good. Thank you. Let's see here. This user says, I don't really understand how my ICT vendor is going to help me make innovation decisions. Can you say a bit more on this topic?
You know, really fair question, probably the most important question today. So a couple of things, right? Think about those last two charts that Patty showed us. The first chart was horizontal blue bars, and it talked about the reality that exists today. The reality that exists today is one that feels a little bit more transactional. It feels like it's based on KPIs and SLAs. And then Patty showed us a chart with some orange and blue horizontal bars where the respondents to this survey said that they desired a much more strategic partnership with their ICT vendor. Let me tell you what we think that looks like. So number one, it's important that your vendor be really well versed in this space. The uniqueness of healthcare and the quadruple aim and patient experience and all of the stuff that goes along with that requires a fair amount of expertise in order to really add value to hospitals and health systems. That, I think, can take a couple of forms. Number one, that vendor needs to have resources that are dedicated to the space, dedicated in this case to healthcare, not just sales resources, but engineering resources and post-sales resources and marketing resources, all lined up to support this unique proposition that is healthcare IT. That dedicated bit of resource is really important. And for us at Spectrum, what we've done is we've taken another step, and that is we've made pretty significant investments in those dedicated resources to make sure that they are really well versed in the space. In fact, we've gone as far as getting our resources trained and certified by HIMSS in order to be healthcare experts, because that is the level of expertise that is required to really add that incremental value and act as a strategic partner to hospitals and health systems. And when we've got people across our enterprise that are dedicated to healthcare, you heard me mention things like, technology that is Wi-Fi enabled that supports fall prevention in hospitals. We've got teams that are working with healthcare providers, hospitals and health systems all of the time, thinking through what these innovations could be, right? My job, our honor is to support these hospitals and health systems, not just with the technology that is in our bag right now, but the next 5 innovations that hospitals and health systems will need. Part of our product roadmap is informed by what hospitals and health systems are thinking. So if you want an ICT partner that is going to act as that real strategic partner, that resource needs to be dedicated, that resource needs to be highly trained and specialized, and that innovation partnership needs to inform the solutions roadmap of the vendor. So that's what I think. I think ICT vendors play this really important role to support healthcare IT in that way, Bridget.
Yeah, and this is Patty. You know, I'd like to add to your answer, Cliff. You know, I think it goes back to letting providers focus on taking care of their patients. You know, that's their core mission, delivering high quality patient care, you know, and enhancing the patient experience. So, you know, the value that the right ICT partner brings to the table, you know, is driving innovation through their technology. They know how to leverage, as, you know, Cliff was saying, they know how to leverage their digital health infrastructure to drive new capabilities. And, you know, like with your other IT partners with specialty expertise, you know, let your ICT partner drive that innovation. So that will, you know, enable already stressed, already time-constrained partners, you know, especially during this pandemic, you know, to focus on taking care of their patients, because that's their core mission.
Awesome. Thank you both. At this time, we are going to wrap up, but just as some final thoughts, I'm going to hand things over to Patty to wrap things up.
Great. Thanks, Bridget. So, Cliff, you know, we've gone through, you know, this great amount of research. There's a lot. So I wanted to, you know, ask you to end, you know, with one last question for you. Having gone through all the research, you know, all the great things that were in there, from that, you know, what advice would you give CIOs who are listening today?
Oh, Patty, you are far too kind. I am operating under no illusion. Hospital and health system CIOs aren't really interested, in my opinion, Patty, and they shouldn't be. But what they should be interested in are the opinions of the more than 600 respondents to this survey, right? Those opinions are the opinions that should matter to hospital and health system CIOs. And let's remember what those opinions are. Number one, everyone across this industry is trying to innovate, and everyone is struggling. And they're struggling because innovation requires dedicated time, dedicated resource, and real focus. And 95% of survey respondents say that the truth is that they don't have a lot of that time and focus and resource to dedicate. 79% of people are trying to innovate, 95% of people are struggling. And respondents also helped us remember that IT is a really important innovation partner. People who are winning at innovation have IT at the table as a driver of innovation or as a critical innovation partner. And the respondents also reminded us that, you know, the connectivity infrastructure, that digital infrastructure, is the critical foundation upon which all of this innovation will be built. And that while these budgets and decision-making may have been distributed, there is just one digital infrastructure, and in order for us to innovate effectively, we are going to have to work across the enterprise and coordinate really well to make that happen. And finally, these survey respondents said to us loudly and very clearly that they need and desire a significantly involved strategic partnership with ICT vendors. So, Patty, your question to me was, what advice would I give to healthcare CIOs? I wouldn't give any advice to healthcare CIOs. I would point healthcare CIOs to the advice that has come back to all of us from the 600 respondents, more than 600 respondents to this survey. That would be my advice to healthcare CIOs, Patty.
Great. Thanks so much, Cliff. And thanks again, everyone, for joining, and have a great rest of your day.